I am excited to welcome our next keynote speaker, who is leading the Veterans Health Administration. I have with me Dr. Richard Stone, Acting Undersecretary for Health at the department. A veteran himself and medical doctor, he leads America's largest healthcare system. We are going to learn a little bit about the efforts over the course of the pandemic, plus what Dr. Stone sees as the biggest challenges and opportunities that lie ahead for the agency. So Dr. Stone, thanks so much for joining us this morning.
Amy, thanks so much for having me.
So tell us, just to start us off, how is VA faring now that we're a year plus into this pandemic?
Well, it's been a long year, and it's been a year that's challenged all of American healthcare. The VA is no different. We have continued all four of our missions as we've gone through. And when I say that, we've continued to deliver healthcare across the nation to America's veterans. We have continued to educate physicians and nurses. Over 120,000 residents show up every day in VA hospitals to be trained. We've continued research in veteran-related diseases and injuries. And then finally, we've served as a backstop to the American healthcare system as we've gone through this pandemic. Tough year, long year. We're anxious to see the vaccine take hold across the nation. And as the vaccines work, we've seen pretty dramatic reductions in the amount of hospitalization that we had been experiencing, as well as dramatic reductions in demand for COVID-related disease processes. At any one time, a few months ago, we had over 3,000 patients hospitalized for COVID. That number is right around 1,000 today. So about a 2/3 reduction in the amount of COVID hospitalization.
That is certainly large numbers, and some of the challenges that you've experienced are similar to things that everyone has experienced across the board. So it's interesting to see that take from the veterans side of things. So VA transition, we heard earlier in the program that they transitioned, an incredible amount of appointments to virtual visits. We've heard the numbers already earlier. What have been the challenges with this effort at VHA? How have you worked to overcome them? How have you seen those efforts come about?
I think we were well prepared for the pandemic and the change. But, we were doing probably 40,000 video and telephone visits a month prior to the pandemic. We're now doing 40,000 a day. And when you begin to look at the demand on the infrastructure, the demand on the ability to schedule that, sustain it. Dominic talked in OIT just prior to this a lot about this, of developing that infrastructure. How many people can be on at the same time? How do you get this done? How do you train a workforce to convert this quickly? Have all been challenges. What's interesting is that the American veteran has accepted this at an extraordinary rate. About 1/3 of our patient population, so we have just over 6 million active users of the system of the 9.5 million veterans that are enrolled in VA healthcare. And just almost 2 million of them have experienced video or telephone visits during this time. About 80% of them have been very, very satisfied with it. So I think we've got some ways to go to improve it. Much of that is infrastructure related in the remote areas of the country. We've debated about cellular enabled versus Wi-Fi enabled pieces of equipment, but it's begun to change our concept of healthcare in America. What's most important to you and I, if I'm your provider and you're my patient, is our relationship. It's not about the brick and mortar. There are digital bricks that we're building today in this change, and you'll hear me talk a lot about building the digital bricks of this delivery system that allow me to interact with you as your provider in whatever place is best for you to receive your health care. Think about your own family. A lot of times you just need some advice from your provider, and it's really hard to get time off to go in to a brick and mortar place. The idea of doing this digitally, I think, is here to stay. Now, the one thing we have found out is that veterans like video-based visits better than they like telephone only visits. And that if they have the choice, they want to be able to interact and see the person they're working with as their provider. And so therefore, you'll see us continually move from telephone-based interactions to video-based interactions as we go through the next few years. But I do expect that we'll move up from 30% of our enrolled veteran population receiving visits to much higher numbers than that. And I won't make any predictions because the team that works this will exceed whatever I say.
Well, certainly you have very valuable perspectives as a medical practitioner yourself, and you kind of have a unique take on some of the efforts that are going on at VA from that health perspective. But there's still a lot of uncertainty around COVID. Overall, we've come a long way since a year ago, and I think today actually marks close to the anniversary of when my team started working remote. So it's kind of like been a momentous year. Just like on the civilian side, there are instances in which veterans have tried to avoid leaving their homes, and so they've put off elective surgeries or put off annual checkups, for example. Are you worried at all about any of this and the long-term impacts on the veteran population? Are you responding accordingly?
Yeah, I think that this is one of the big unknowns. After the great influenza of 100 years ago, there was tremendous ongoing health problems in the decade that followed that. And that's certainly well documented in history. The CDC last September published data showing that 41% of Americans have delayed or deferred healthcare during this time. And we see that in reduced numbers of mammograms and reduced pap smears and reduced colonoscopies. These are screening tools that catch diseases early. And I have very significant concerns about the fact that veterans, just like all other Americans, have delayed or deferred health care. And one of the messages we'd like to get out in these sorts of discussions is that we're open, it is safe to come in, and we need you to come in to do your routine screening appointments. And if you've delayed anything, any of your listeners, you need to get that work done so that we don't see more advanced diseases as we go through. Our numbers of surgeries are down about 12,000 surgeries a week. We do, before the pandemic, over 60,000 surgeries a week, and we're down around 50,000. And those are all diseases that need to be cared for. And as we vaccinate the majority of veterans, today we're going to celebrate 2 million veterans that we vaccinated with at least their first dose. And I'm pretty excited about that. That's about a third of the active enrollees. And veterans need to come in for their care. And that's the thing I worry about the most. Are we going to be able to come back from this? Now, there's lots of other worries specifically about the pandemic. And that is this a endemic virus to the human population? Are we trying in the vaccination to eliminate the virus like we did measles or polio, trying to really get to 95% of the population and truly eliminate this? Or are we trying to stop death and serious illness? And it seems like it's the latter. It seems like the vaccine is very effective. All three of them that we've got here in this country are very effective at stopping death and serious illness. What's yet to be really understood is, will it stop the transmission of this virus altogether? The COVID virus has been with us for many decades, and the COVID virus has multiple variants, and is a type of COVID virus is responsible for causing many of the common colds we see in the world. So it's my belief that this will be an endemic disease, and that we will deal with immunization to stop the effect on death and serious illness, but it will become an endemic disease to the human population. And I think that thought is shared by many around the world public health infrastructure.
That's certainly no one likes uncertainty, but it seems like how VA is responding and how the health community and science community is responding is really putting some optimism out there, especially with the vaccine here now. And you mentioned, almost 2 million veterans and employees vaccinated now. Those are impressive numbers, but there's still a long way to go. You've administered vaccines yourself to some of your employees. How is VA keeping up with that demand, and how do you see that pursuing in this next phase in the pandemic response?
We're receiving, I think next week we'll receive just over 211,000 first doses. We built the system to deliver between 100,000 and 300,000 doses a day. So we've got plenty of capacity. We've been running about 50 to 60,000 doses a day. And our goal has been that if we get a delivery on Monday, then we want to make sure that within 4 to 5 days we exhaust our first dose delivery system. And so we built extra capacity in, and the idea was quite transparently to be the first people in line to say, we'll take more when more is available. Now, because of that, we've exceeded the nation in the rate of veterans that have been vaccinated. And the other thing is that veterans have really lined up for this vaccine. There was a lot of talk about Americans' hesitancy to take the vaccine. Veterans have taken the vaccine at extraordinary rates and continue to line up for the vaccine for us. And we're very pleased. We started out with our essential workers, our frontline workers, and our veterans living in congregate living situations, our spinal cord patients we started out with. And then we went to the next phase, which is over 75 and then over 65. And you'll find areas of the country that now are open to all age veterans as we've worked our way through. And we've given broad latitude to our delivery system to make decisions on what's best for their community. And we recognize that what's best in San Francisco may not be best in Biloxi, Mississippi, and that there's different rates of acceptance of the vaccine. We were surprised in Northern New York that 1,000 veterans in one of our medical centers in Northern New York over age 75 refused the vaccine. Now, we went deeper on that and found out it was because so many of them had the virus a year ago when the virus was really overwhelming New York State. And they, as good citizens, were deciding not to take it, figuring that they were immune. Now, we've done some education and we're working our way through that. But veterans are taking this vaccine really well. The other thing I'd like to just mention is there's been a lot of discussion about communities of color and whether those communities of color will take the vaccine. We started last September doing some sensing sessions before the vaccines were even available, trying to understand how we could communicate with communities of color. And I'm very pleased to sit here today to tell you that the highest rate of vaccination of our over 75 group is in our Black veterans. Second highest is Hispanic veterans, followed by our white veterans. We do have problems in our rural areas, but primarily in the rural areas, we're dealing with white veterans, and we've got a ways to go to get communication and trust to where it should be. We've debated a lot about why that is so and why we're doing well. And part of it is we are in these communities, and we have been for 100 years in those communities, and we are trusted members of the community. We found from those sensing sessions that the most important thing that we could do is to have providers communicate with their patients. And therefore, we've sent out millions of communications between providers and their patients. I was just up in the Bronx doing some vaccination clinics with FEMA, and we talked a little bit about one of their programs. And they take veterans that are refusing to take the vaccine and literally within 24 hours have their provider call them and say, here's why I think it's important for you to take this. And between 15 and 30% of them will immediately go get the vaccine. We then match veterans to other veterans and have them have discussions between them so that they can make informed decisions. And I think those strategies have really helped. And I think it's unique in American healthcare and really is something that the VA is doing that has led us to this sort of premier status in vaccine delivery around the nation.
That's great. And health equity, you discussed it thoroughly just now. It's something that other health agencies and other health organizations are dealing with across the board. So it's nice to hear the progress VA is doing there, and then the strategies that consider that, especially when you think about the leadership priorities right now with meeting the veteran where they are. We heard it in the previous panel with the veterans experience side of things of reaching out to the veteran. Do you think that these efforts are really pushing home that idea of breaking down these barriers to address health equity in veterans?
I think it is. I think we continue to demonstrate in a number of areas the value of a nationwide integrated healthcare system. And that integrated system is really centered around the veteran and the ability to take integrated electronic medical records that allow data sets to really come together so that there's full visibility across the veteran's lifespan of whatever is being done. We buy about 30% of our care for a veteran in the marketplace, and it's different in different markets, but about 30% of care is purchased. We need systems in place that allow us to immediately capture the results of testing and of care that's being given in the community. The VA will always be the centerpiece of the integration of that care, and therefore the veterans' primary care delivery team will be the centerpiece, and we may buy transactions of care out in the community, but we need systems in place that allow information to traverse very quickly to reduce inefficiencies and to assure that we're delivering veterans the timely care they need. And you ought to be able to sit in your home and connect with your provider and go over the results of the studies that were ordered, no matter where they were. And therefore, we've pushed industry to really develop the amount of data exchange that is necessary for us to run a system of that complexity.
Fantastic. So I know we're coming up with a couple minutes left. There's so much more things I want to ask, but I do want to address, as a veteran yourself, you served 20 years in the Army. Thank you for your service. I'm an Army brat myself. You spent time in Afghanistan. I wanted to ask if you took any lessons or activated any lessons from your time in the military to combat this pandemic or other challenges at VA right now.
Yeah, all of us that are veterans on the across this delivery system, about of the 360,000 employees, about a third of us are veterans, and I describe this just like a deployment. This has been a long, difficult deployment, and the main issue I say there is that you have to get to about 60% on any of your decisions. You can't wait for it to be perfect. You can't wait for the data analysis to get to be perfect, and you've got to just run forward. And therefore, we've broken down a lot of bureaucracy. We've let the bureaucracy catch up to us as we've tried to save as many lives as we could. Our fourth mission, being the backstop to the American healthcare system, we have preferentially taken critically ill patients out of the community who are not veterans and tried to save as many lives as we can. When you're doing that kind of work, when you're working and breaking down bureaucracy in order to be as agile and flexible and resilient as you can, you got to realize that sometimes you're going in the wrong direction. And you got to be willing to check your ego and change course quickly. And I think we've done that very, very well. And I'm really proud of the resilience of the VA employees and how they've done through this. It's an extraordinary organization and has really been one of the key successes of the response to the pandemic.
Well, Dr. Stone, thank you so much for taking the time out of your morning to join us and talk about these important issues at VA and the incredible progress the agency has made over the past year. So I thank you so much for joining us.
Thank you, Amy.
All right, I will be introducing our next panelist momentarily. Thanks so much.